New research from CU shows mental and physical illnesses could be more tied together than previously thought.
Yeah, it seems that way. 9 News health expert Dr. Paolo Colli is here now to walk us through what this study means. This physical health, mental health connected. What was this study trying to find out when it set out?
So we've known for a long time that, physical health affects mental health and mental health affects physical health, but we always thought it was all behavioral. It was all environmental. Oh, you just have bad habits when you're stressed out and that's why it affects your physical health. Or if you get a diagnosis like a cancer diagnosis, of course, that'll make you anxious and depressed or what have you. But this study sought out to see, is there a genetic predisposition that's not one causes the other, but independently causes both together? And we're actually getting confused and saying, oh, one causes the other.
Yeah, that's so interesting. Yeah, like you said, the obvious I think we all think about. So what made this different from other psychiatric conditions?
Yeah, so it looked at 1.9 million people, and what it did is it looked
That's
at
a big study, yeah?
Yeah, huge, but it looked at our DNA. And so we've gotten really good at looking at our DNA and seeing what the DNA markers of illness are. So it looked at 73 different medical problems, 13 different psychiatric problems, and looked to see whether there were overlaps in the DNA that causes both. 42% overlap.
Wow.
So it wasn't really that one is causing the other, that, oh, I'm stressed out and so I'm, not exercising and eating more, but more that whatever makes me not exercise, eat more, and gain weight is also causing me to have underlying metabolic conditions, heart disease, a lot of the other factors that go together.
You live in the medical world and you read studies all the time. For those of us who don't, put that number into perspective, that 42%.
It knocked our socks off.
Right.
Because we thought, okay, maybe there's a little overlap, but you're talking nearly half overlap. And you're talking about specific diseases causing specific overlap syndrome. So, for example, if you have schizophrenia or bipolar, these are considered psychotic spectrum diseases, or OCD, for example, obsessive compulsive disorder. Those didn't have medical illnesses as strongly associated with them. But these other diseases that we deal with, which are called internalizing diseases. So I'm talking about depression, I'm talking about anxiety, I'm talking about rumination, PTSD. In our kids' ADHD, these were much stronger in terms of their association with cardiovascular disease, inflammation, and metabolic syndrome. So this isn't by accident, this is biology that's causing both of these conditions to coexist.
So you don't want to be negative and say, oh my gosh, my genetics are telling me this is going to happen to me.
Right.
That you could use this as a positive and say, I'm making changes in my life because I probably am predisposed for it.
That's exactly right. So what I'm hoping as a physician is that we can now start screening people for psychiatric illnesses, just like we screen for heart disease in their 20s, so that we don't just wait for it to manifest and then say, okay, now let me think about treating it. But we say, okay, if you're at high risk for heart disease, maybe I can check your DNA if you see it high risk for anxiety or depression or what have you, and get you ahead of it. So more aggressive screening, but also when we think about treatment, Kim and Phil, I want to think about a combined approach, because one never works without the other. And I'm constantly dealing with patients who have, they're on Adderall for their ADHD, and it's driving up their heart rate, and it's driving up their blood pressure, and I'm, chasing my tail here. So really, I think what this study has done for us is made us rethink how we think about medical and psychiatric illnesses. They're the same. They're two sides of the same coin, 42% of the time. And so we really need to think about a combined approach when we're treating, both in screening as well as coming up with new therapies for them.
That's the way, gotta be. All right. Thank you, Dr. Colli.